So there is light at the end of the COVID tunnel. Another vaccine boost today and the national lockdown is ending next week. But for our hospitals, the next few months could be the toughest yet. Already treating record numbers of coronavirus patients, staff are now facing the extra pressures that every winter brings. Since the spring, our health correspondent Gill Dummigan has been reporting from the East Lancashire Hospital Trust. And in the latest of her exclusive series, Gill and cameraman Sean Twomley went to the Accident and Emergency Department at the Royal Blackburn.
The past few weeks has seen a record number of patients with COVID arriving at A&E.
They say it's like a flu symptoms. I've never known a flu symptoms like this. Now they're saying I'm losing a bit of oxygen when I'm walking. I was only going upstairs, maybe coming right down, and I just wanted to lie down and sleep.
And is that a bit worrying?
Of course it is, yeah. You know, I have kids and families and stuff. They don't want me to go anywhere.
This second wave has coincided with the start of the hospital's busiest time of year.
It is worrying. Winter's always worrying in ED terms. We always think, oh, it might be different next year, and it isn't.
But this winter has brought a whole new set of problems. In the first wave of COVID in the spring, the number of patients coming in for everything else dropped off sharply, but that's no longer the case. And so the staff here are having to cope with large numbers of patients with and without COVID coming in at the same time and trying to keep them all safe. To do that, the department and the hospital is divided into red and green zones for patients with and without COVID. But many arrive without a definite diagnosis either way, so they have to be tested.
Okie dokie, if you can open wide for me.
Muriel's here after a suspected mini-stroke.
Don't swallow it.
I feel like I've been hit with a cricket bat on my chest and my back and my head.
That must be quite worrying.
It was frightening, I'll tell you.
Stroke patients get the results within 90 minutes, but most people have to wait several hours. It's unsafe to put them in a ward without knowing their COVID status, so that means big backlogs in A&E.
That is very difficult, and obviously we can't have red patients on the corridor, so sometimes it means that there are more green patients on the corridor. We do have to put patients on the corridor because there is nowhere else for them to go. We can't shut the doors of A&E.
To ease pressure on the emergency department, the hospital also has 2 acute medical units where patients can go for further assessment. One is now reserved for patients who might have COVID, leaving just this one for everyone else.
So we are getting a significant number more than we would do at this time of year.
And do you sometimes find that it just fills up completely here?
Oh, yeah, we come to a standstill.
And what happens then?
We obviously try and get more ward rounds, get more people seen, get people moved, but it is very difficult.
But some things are improving. Until a few days ago, most COVID tests had to be sent away for processing, but the hospital's just taken delivery of its own processor.
The machine is looking for some molecular material for COVID. It amplifies it up so that it is in large enough numbers to be able to detect.
This machine means that results which were taking up to 2 days to come back will now be there in around 4 hours.
And it will help that patient who's come into ED, if they have to be admitted, the clinicians will be able to make a reasonable decision about which patient flow they have to go into. It gets the patient to the right place with the right safety levels in the fastest possible time.
So the new test should help the situation in A&E, but everyone here knows the toughest months are still to come.
We're going into the winter hoping that we've plateaued, but over the next few weeks we'll know whether we have plateaued or not, or whether things are going to keep increasing. We've managed to keep everything safe so far, and we're hoping we'll continue to perform in the same way.
But much of that depends on what happens post-lockdown. So you know those people who just say, well, we've got to live with it. What do you think about that?
I think it's talking rubbish. They don't know what they're on about. It's hit me really bad. And I've been 13 days in me, and I think I'm quite strong. So yeah, you don't want anybody to catch it, trust me.
I think people have been trying very hard, and I think understandably some form of fatigue is setting in now But the message that we would give, with the vaccine situation improving, we need people's patience and efforts for a while longer.
Gill Dummigan, BBC North West Tonight, Blackburn.